Dear friends, many of you could be COVID victims, and as you know, 80 to 90% of the COVIDs they recover fantastically. But let me tell you, nobody has understood this disease so well because we all healthcare professionals are learning from the patient's experiences. It's very important that those who have recovered from COVID or recovering from COVID, they should undergo a post-COVID rehabilitation structure program. We at SANS, we are regularly handling these post-COVID patients, started a structure rehabilitation program. Main aim of this structure rehabilitation program is to improve your coping mechanisms, to improve your lung health, and most important, to enhance your immune system so that you lead a very complete, comprehensive and holistic health. Now dear friends, what exactly happens when you have suffered from COVID? Number one, because of the panic across the globe, this COVID creates a lot of mental health dysfunction, what we call cognitive distractions. So even if you have recovered from COVID, when you're admitted in a hospital or in an isolation center, you develop a tremendous amount of anxiety and apprehension, what we call a kind of depression and a sympathetic behavior. As you perhaps must be knowing, our human system, other than our central nervous system, there's a very important system, what we call autonomic nervous system, which is a balancing system. For every aggravating system, there's an opposite. Like sympathetic system is something like your excitement, anxiety, anger, restlessness, and parasympathetic means feeling relaxed, good sleep, feeling positive, inner peace. So we have to create a parasympathetic behavior. Even if you have recovered from the COVID, that experience is so bad and traumatic. So everybody in the post-COVID phase, number one, they have to do certain mental health practices, and which I will be telling shortly. Number two, since COVID is a disease of the immune system and it has the two components, the infective and the inflammatory phases, and many of these patients, they are into inflammatory phases, and sometimes it has been said that they have recovered completely but the inflammation can go up. So regularly, once in a month, you should monitor your inflammatory markers like LDH, CRP, D-dimer, serum ferritin, and CBC, because this will help you to know whether the inflammation is on or not. So keeping a track on his inflammatory markers, which I feel at least for 3 months you should be monitoring it, we will able to know whether the inflammation is still on or not. If these markers are high, then we'll recommend that you should be on some low molecular heparin for a longer period of time so that this cytokine storm doesn't come back. Many times we have seen people have completely recovered, but they can start developing downhill after a month or so. So it's very important to do these markers on a monthly basis. Number three, we have to enhance our lung health. And you know, this respiratory virus affects your upper and then lower respiratory system. Good power breathing techniques, which we teach at SANS breathing program, is very effective. It's really will enhance your lung, cleans your lungs. That is the third thing. Fourth thing is that you do work on immune system. And how can you enhance the immune system? You can enhance the immune system by good diet. Your diet should be rich in proteins, a lot of antioxidant, veggies and fruits, and a lot of relaxing substances. Then of course, a good amount of sunshine, regular high intensity exercises, all those things. So what at SANS we have planned a post-COVID rehabilitation program where we take the patients in a structured rehabilitation program. It's a 6 weeks program. Twice a week we call these patients. Every program is a combination of a physical wellness, mental wellness, emotional wellness, environmental wellness, social to spiritual wellness. It's a 360-degree program. In physical wellness, we talk about the physical fitness, the muscle stretching, breathing techniques, nutrition, and overall physical monitoring. In mental wellness, we talk about how to remain positive, how to see the bigger picture, how to come out with, how to face these new challenges and see the bigger picture and live healthy. In emotional wellness, we talk about how to cope up with the emotional experiences which you had. There's random emotive behavioral therapy. REBT is a very effective technique. In mental wellness, we use cognitive behavioral therapy, and we believe the cognitive behavioral therapy works on the principle of thought, behavior, and emotions. We try to change the thought by regular our counseling sessions, and we change the behavioral changes, and that is how this effective actions to change. So cognitive and REBT is a very more useful techniques we are using at our SAS for this mental and emotional wellness program. Then finally we take them to environmental wellness, because you have to be in a new environment, you have to adopt certain new rules. At the same time, people should not develop a social stigma about these COVID patients. So environmental wellness involves a lot of flow of energy, and that we talk about, little changes which you have to do around yourself so that you feel good. Then comes the social wellness. Social wellness is something which you have to adopt, introspect about new things which you can do, which can keep you happy. Social wellness is not that you're going and mixing up people. It is that you have to create a kind of niche among yourself which can help you to give the inner peace and relaxation, which can involve certain relaxation techniques, adopting some habits, nurturing certain habits, then doing certain structured program which we teach here. And finally we talk about the spiritual wellness. We are using a lot of spiritual techniques, because spiritual wellness is not religion. It's basically parking. You have to believe in yourself that whatever you have gone through, that you have to take it out and have to go for an inner peace and happiness. So this structured 360 program is a need of the hour. Not many people are doing, since now we are getting a lot of COVID survivors. So my humble request to all these COVID survivors that they should take this program and try to adopt a new post-COVID adaptations in their new life. I call it new renaissance. And if you follow this holistic program, which is a 360-degree program, it can really enhance your immune system, improve the lung health, and prevent certain complications. So for any kind of information, you can contact us at our number and go to our website.